You just start.
In 5 seconds.
Hey everybody, welcome to Lunch Hour Live. Sorry we're running a little bit late. I'm Sue O'Connell, and of course summer is in full swing. The humidity's killing us, but we're ready for our summer vacations. And while many of us are embracing staycations this summer, some of us may be flirting with the idea of actually going to the beach and renting a Cape house, or maybe just taking that epic road trip you've been planning your whole life. But even if we are just going to go down to the Cape for a week, how safe is it? Well, joining me to help answer this question and your questions, I'm joined by Dr. Mark Shrime. He's the chair of global surgery at the Royal College of Surgeons in Ireland and a lecturer on global health at Harvard Medical School. Welcome, Dr. Shrime.
Thank you for having me.
Shelley Christiansen is a realtor at Coldwell Banker on Martha's Vineyard. Welcome, Shelley.
Thank you for having me.
And Brian Carlstrom is the superintendent of the Cape Cod National Seashore. Welcome, Brian. Thanks so much for joining us.
Happy to be here. Thanks, Sue.
All right, so Dr. Shrime, I want to start with you and just give us a broad headline. What's the latest science? We know it's evolving, but what do we know right now about how COVID is transmitted when we're outside, when we're at the beach, when we're just trying to do some good social distance, normal living?
Yeah, so let me start by saying that the science is evolving and it changes on a weekly basis. But what we do know, we know, first of all, that this is a respiratory virus. So it's primarily spread from what we breathe out, sneeze out, cough out, but not solely. It's also spread, as other respiratory viruses are, through contact as well. On the flip side, positively, we know that the spread is decreased in outdoor conditions. It's much easier to transmit the virus indoors than outdoors. So places like the beach are probably safer than places like sort of an indoor arena or a movie theater or things like that. And then, Sue, you mentioned social distancing. Physical distancing is still very much a thing if you're at the beach. You can lower your risk of getting it from others or transmitting it to others if you and your pod of people stay away from other people.
Shelley, I want to switch over to you and talk a little bit about, the mainstay. Before there was Airbnb, there was renting Cape houses and houses on Martha's Vineyard and weekly rentals. What's happening on the Vineyard? How are things changing around renting habits during the COVID-19 crisis?
It's been a wild season. And as you know, I work principally on the sales side of the business, but I know the rental business well, both as a colleague of a number of rental agents, a friend of many rental agents, and also as somebody who happens to be a vacation landlord. And I've always been happy not to be a rental agent, and this year I am especially happy not to be a rental agent because they are just going bananas. I mean, they are ready to slit their own throats. So typically in a normal season, July and August bookings happen almost a year in advance. As soon as people, leave, they call their agent, we want to book the same time next year, we love this house, blah, 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 blah. So the rentals are pretty much in place, certainly by the end of the year. Well, when COVID hit, all of a sudden people got very nervous and they were calling up and trying to cancel their, reservations, like crazy. And we're not talking reservations per se, we're talking leases. We're talking about ironclad contracts. Mm-hmm. So, in a typical vacation rental lease, the cancellation policies don't have a clause for, if there's a pandemic, then okay, that's your get out of jail free card. No. So there were just, the phones were just ringing. March, April, May, everybody trying to get out of not everybody, a lot of people trying to get out of their rental contracts. Some landlords saying, sure, I understand, I'll refund you, or other people, or a lot of people made arrangements, well, let's book for 2021, same week, you can hold on to our deposit till next year, fine. There were other landlords who said, you know what, too bad, so sad, you're going to lose your deposit, and that's, and legally, that was, they could do that. So there were a lot of, but meantime, landlords who booked through agencies, there were some agencies that would, if the landlord was being generous and said, okay, I'll give the money back, they didn't necessarily get that commission payment back. painted. So it was.
It's been a patchwork. I can imagine.
It was crazy. And
Brian, I want to ask about, I know we've been through the Memorial Day, which usually is the unofficial start of the summer season. Happened a little bit early this year, but we're getting ready for the 4th of July. What steps are you taking at the National Seashore following the guidelines set by the state of Massachusetts to try and keep people safer around the COVID-19?
It's all about our messaging to help people realize the practices they need to have in place when they're choosing to come out and recreate and have a good time on the beach. Social distancing, physical distancing on the beach is critically important. And what has been recommended through Governor Baker's reopening plan is that folks stay 12 feet apart when they're on the beach, so that there's enough room for folks to walk in between the different pods, as like a doctor referred to them as. It's kind of an abundance of caution, but our primary goal at the National Seashore is to try and slow the spread of this. And that's what we're doing. Those are the kind of practices we put into place. Things are going to look very different when folks come out this summer, but they're going to be seeing all kinds of messaging about wear face masks, maintain your physical distancing, be very respectful of one another, act kindly to one another. We're all going through this together. It's a pandemic, and you might be choosing to go to vacation. Nobody's done that before. So please just pay attention to all the information and data that's being shared with you. Heed it. And remember, you're coming out to wild beaches in the National Seashore. All the other things that you always need to pay attention to, from when you're on the beach, drinking lots of waters, staying hydrated, sunscreen, that all still applies. And in the ocean itself, the currents, the near shore breaks, the tidal shifts, that's what poses the greatest danger to our beachgoers, is that inactive zone.
A little bit and ask you guys a question and let folks know that they can ask us questions here on social media. Just put a question in the comments and we'll get it to our guests. And ask if you're planning on taking a vacation. Doctor, is your family going to vacation this summer?
Short answer, no. I think a lot of us in the medical field have decided that for sure this summer, short local trips, sure, nothing far, and then probably not even for the coming fall and winter. This is likely to unfortunately be with us for longer than just a few months.
Shelley, I know you're on the Vineyard, and as many people in New England like to say, why would I vacation in the summer when I'm on the Vineyard? But would you be vacationing this summer?
No, well, in my field, this is typically our busy season. And what's kind of ironic right now is that it's been busier than ever from a sales standpoint. When back in March, again, when the pandemic first hit and the stock market went into free fall, and we thought, oh no, this is just forget sales this year. But after, especially just in the past couple of weeks, I guess ever since phase 2 kicked in, people are able to travel here and actually book a hotel and stay for a weekend and look at properties, and deals are being made like crazy. I was just yesterday looking at statistics for this June in terms of offer agreements coming together. As of yesterday in June, there were 50 offer agreements. That's a lot for our market for less than a month. And last year, for the same period, it was 22. So,
it's a volatile and interesting time to be in the real estate business. Doctor, I know that you might have to leave us soon, so I want to ask you, what would be your top sort of 5 pieces of advice for people in either a method of harm reduction if they're going on vacation? I mean, many of us are living with people who aren't always doing what they should be doing. We're going to be interacting with people from different states, perhaps, who haven't been under the same protocols that we've been under. What are the takeaways for you to give to people if they're going to be vacationing, locally here in the Massachusetts area, visiting the Cape for the summer or the islands?
This is a great question. I think the first thing that I want to highlight with this is that the decisions that individuals make don't just have an effect on them. This is very different than, say, smoking or eating that big hamburger. the decisions that we make have impacts on people that we might love, and also sort of on the broader dynamics of this pandemic, which, as we all have been seeing in the news, is going in the wrong direction in the U.S. right now. So keep that in mind as you're making decisions, that it's you're not just deciding for yourself, you're deciding for your loved ones, your neighbors, your grandparents, and others that you may not even know. That said, you're right. I mean, we're going to be seeing people that come from other states that may not have had as severe a pandemic as in Massachusetts, and so therefore weren't under the same stress. The things that Brian said are the things that really you should pay attention to. Literally all the messaging that Brian just went through, wearing face masks, staying separate, hand hygiene, wiping down what are called high touch surfaces, doorknobs, things like that, nothing's going to make the risk go away, but all these things can help mitigate some of the risk that you face and that you face at transmitting the infection to others, even if you don't know you have it.
Brian, I want to back off
because
you mentioned sharks. Last year at this time, I think that's all we were talking about in the media, even though the risk of a shark attack is still one of the lowest risks there can be. Me driving today to the store is going to be a higher risk. But at the same time, folks want to know, is the shark risk high on the Cape and on the islands? Are you more concerned about sharks than you are about COVID? And are masks required while you're at the beach? Are there facilities available, restrooms, places that people can hydrate and take care of themselves?
All right, sharks, masks, restrooms. Here we go. Sharks are always a concern. It's a wild ocean. They have been returning as the apex predator in the marine ecosystem, and because the gray seals have returned as well, which is their primary prey species. And you just want to be cognizant and practice the Shark Smart principles. Stay in groups. If you're going to swim, make sure you're doing so with minimize your splashing. Stay close to shore. Listen to the lifeguards. If you're going to choose to do any paddle sports, try and do so in groups again. There's some different products out there that can have you look a little bit less like the prey species. Use some striping if you can. It's it's a risky activity anytime you get in the ocean, and white sharks are now a part of that risk that you need to consider anytime you're going to recreate in it. As a former boogie boarder, how I do it is much different. I've been a lifelong boogie boarder, still do it, and that's something you just want to pay attention to. Stay closer, stay in groups, be careful. Now for masks, that is highly urged, and we are wearing masks quite often ourselves when we can't maintain physical distancing as employees at the seashore, but it's not a requirement for us. It's something that we urge people to do. As Dr. Christiansen said, you're making decisions that affect many others beyond yourself. So we encourage people to do that, to be courteous to others and be highly respectful. And then restrooms. Our restrooms at our beaches are going to be reopening, but our number of staff that we have to attend to them is down as well. We're highly dependent on the number of seasonal housing units we can offer, and in order to accommodate potential infection, we have fewer beds this year. So we will not have our restrooms at some of our remote sites, some of our trailheads. Restroom services just won't be available. But all of our beaches, we're working to get them open, hopefully by this weekend.
All right, Shelley, I want to go back to you and ask you, if folks have plans to rent and they're on their way, what are some of the conversations they should have in advance with the landlords or with the renter before they get there? Is there some protocol that you would recommend, some conversation points we should bring up?
That's a very good topic to bring up. And first of all, let me say that ever since phase 2 kicked in on June 8th or whenever it was, all of a sudden there was a surge of people renting. After all the cancellations, now there's a surge of people renting. And, but yes, a lot of people have questions around, okay, how recently was somebody in the house before me? Because typically there's like a 10 a.m. checkout time and a 3 p.m. check-in time. And in between, the cleaners are in there working mad. So a lot of people are specifically looking for rentals where maybe there was a gap between tenants, so that they're not coming in right behind somebody else. Cleaning protocols. And by the way, anybody, can look at websites for, I would recommend Massachusetts Association of Realtors or the Cape Cod and Islands Association of Realtors, CCIAOR. All of those have great answers to a lot of those questions in terms of the cleaning protocols that are in place now, which follow very along the guidelines of the CDC. In terms of, just wiping down more surfaces, whether it's the back of a chair or, just going above and beyond what's normally done in a typical cleaning. Some landlords are now asking for, for tenants to allow a later check-in, just so more thorough cleaning can happen. I personally am giving each of my tenants, I happen to have a stash of exactly 3 sanitary wipe canisters. I'm letting each one have and letting them know, okay, my cleaners have been ultra cautious and careful, but if you're still nervous, here's your own can and you can go around and wipe stuff yourself.
Dr. Shrime, I want to get back to you because I know that you have to leave us, but I just want to ask if I know that we're looking at numbers that are happening across the country in Florida and down the South in Texas and Oklahoma City, with concerns of people under 50 having COVID and having hospitalizations from it. Are you optimistic that Massachusetts is going to get through the summer and try to keep flattening that curve, as it seems that at least we've been successful thus far?
Yeah, let me say, first of all, that on some of the measures of sort of success in this pandemic, Massachusetts has been the top at containing this. So what's been done in Massachusetts has been amazing. I think there's 2 things I want to say to that. The first is that, yes, the pandemic is definitely not over in the rest of the nation. It's definitely, spikes are happening in the South and in the West. Some of that is likely due to behaviors from us as individuals. And I think I want to get back to something that Brian said. Masking is one of the easiest things that you can do to keep this under control. So it's not required. The governor has not said you must mask, but it is such a simple action that you can do to prevent the spread of this virus to other people. There's not as much evidence. There's some evidence that it protects you, but there's a lot of evidence that it protects others from you. And so as people who live within a society who want to get back to vacationing and hang out with our friends, this is one of the safest and easiest things that you can do.
Okay, Doctor.
Just mention that
because he has to jump. Thank you so much for joining us. I appreciate it. Shelley, what do you want to say?
Thanks for having me.
Just going to mention on top of what Mark was saying, one of the things that has been somewhat startling to us here on the Vineyard is that, Vineyarders have been ultra conservative, ultra cautious, thanks to, we have some very hard-nosed, boards of health and our hospital director. So we've been very conservative when it comes to masking and distancing. And now that the visitors are starting to come, we are just startled to see so many people walking around without masks, without distancing. It's frightful. And we keep wondering, is there anybody who can enforce this? I actually thought it was a requirement until Mark mentioned it's not. But there are signs all over the towns and at various establishments saying masks required, and so many people don't seem to care, and it's scaring us a little.
I want to just finish up with you, Brian, and just ask a question about wildlife. I'm living here in the city in Roxbury, and I'm coming across possum and raccoons, and we've had the turkeys and birds that I've lived in New England my whole life, and I'm seeing birds I've never seen before. I imagine that where the natural habitat is on the shore and on the islands, there's been an emergence of animals, and that if we're going to go to the seashore and enjoy nature this summer, we should be extra careful, no?
Yeah, there's definitely an enhanced presence of wildlife out and about. At the seashore, where our access points are, we were open throughout. So the animal populations out here, the wildlife, we're still experiencing a pretty regular occurrence of encounters with people. So we, unlike a lot of urban areas where it changed drastically and the behavior patterns were very different, on the seashore it was pretty typical. So we haven't seen the major resurgences of wildlife. We did have what we unfortunately have from time to time, a coyote that became habituated to interacting with people up at Herring Cove, and unfortunately had a couple of encounters that were just too close and creating hazards for the public. So that one coyote we did have to remove, and it was, our rangers had to dispatch it and remove it. So that's an unfortunate occurrence that does happen from time to time. But in general, the wildlife is here for folks to enjoy and observe. We have seen an uptick in abundance of some of the species. And as always, that's part of the enriching experience of coming out to the National Seashore, is seeing the piping plovers, seeing the shorebirds. If you're lucky, you might see a shark. You will see gray seals. And I say it in that way because people are now coming to the seashore. And one of the most popular questions we have to our rangers at the visitor centers is, where can I go to see a shark? People go to Yellowstone to see wolves and grizzlies. People are now starting to come to Cape Cod because it's one of the few places in the world where you can actually see a shark from the shore. Kind of unique, kind of different, and kind of a perspective that we often don't think of.
Well, thank you so much. I want to thank you both for joining me on our Lunch Hour Live. I want to thank everybody for watching online on Facebook and on Twitter and at our website. Have a safe and healthy summer. I appreciate the time you spent with us, and I'll see you again soon. Thank you.
Thank you, Sue.
Thank you, Sue.
Bye, Brian.